Welcome to the Experimental Honesty Podcast. I'm Brian Curtis. Today I'm speaking with Dr. Kate Morrison. Kate's a clinical psychologist. She's co-owner of the group psychology practice Juniper Mental Health, and she specializes in treating anxiety, obsessive-compulsive disorder, body-focused repetitive behaviors, problematic perfectionism, and related concerns in adults. Kate uses a number of evidence-based treatments in her work, which include acceptance and commitment therapy, exposure-based therapies, cognitive behavioral therapy, and habit reversal training. Now, Kate's an incredible psychologist and a really great human, and we'll all have the pleasure of having Kate walk us through one of her favorite psychological skills today, which just so happens to be one of my favorites as well. It was really, really great to chat with her. And you can learn more about Kate and her work by visiting Juniper Mental Health at junipermh.com. And you can find many different mental health resources on the resources section of that website. Okay, let's talk to Kate. Okay, so I am here with Dr. Kate Morrison. So, Kate, thanks so much for taking the time to chat today.
Yeah, thanks for having me, Brian.
Absolutely. And so you are a clinical psychologist, right? You are also co-owner of the group psychotherapy practice, Juniper Mental Health. People can find you. It's junipermh.com, right?
Yep.
Okay. A bit of your background here. You specialize in treating anxiety, also obsessive compulsive disorder, body-focused repetitive disorders, problematic perfectionism, and related concerns. And you treat people, these are adults, right? You work with adults and you do these science-based therapies, right? It actually has empirical evidence. So things like acceptance and commitment therapy, exposure-based therapies, cognitive behavioral therapy, habit reversal training. So how did I do there? Does that sound like a basic background for you?
Yeah, that is excellent. You covered all the bases there.
Beautiful. So, in terms of how you got where you are, right? Your story here. So how you got into becoming a clinical psychologist, why this stuff is important to you. Can we hear a little bit about your own personal story here?
Sure. I learned of the field of psychology while I was in high school. I took a class in high school just a bit randomly and really found that I was interested in why humans do the things that we do. And through that class, I grew up in a rural part of Nevada on a cattle ranch. And one of the things that really stood out to me in that class was behaviorism. And I was excited to come home and tell my dad, like, hey, all of the things that you've been teaching me of like how to train dogs and horses, like these are principles that have names in this world of psychology. And I don't know that he was as interested in it as I was at the time, but that's something that really clicked with me, to see that we can understand and adjust behavior across a lot of creatures, including humans. So that really catapulted my interest in psychology, and I went into a field of applied behavior analysis, where in college I was working with kids with autism and adults with intellectual disabilities. And then from that work, I really wanted to go more into clinical psychology, so working on topics like anxiety and depression and OCD. And during my time as an undergraduate, it was recommended I get connected with this research lab at UNR, the University of Nevada Reno, that was doing a type of therapy that really makes a lot of sense to me. And I started doing that work and really continued to specialize in that through grad school, and have continued doing that work since. So I've really honed in on, like you said, OCD, obsessive compulsive disorder, anxiety, and things that are related to those, really focusing on helping people change behaviors that they want to change, but the stuff that's happening internally is getting in the way of that.
Yeah. As you were talking about with the cattle ranch and behaviorism, one of the books that I read in my training, it's called Don't Shoot the Dog. I don't know if you've read that one. Okay, yeah.
No.
The title, I was like, what is this about? But it's just, it's an animal trainer, and it's exactly that. These principles of behaviorism that expand. It's not just us, but these principles are extremely powerful if you understand them, and then applying that, clinically. Anyway, it was like, don't shoot the dog. Why am I reading this? Like, oh, this is extremely useful kind of across the board. And so during your training, you were at UNR, those experiences ending up in the populations you're into. Is there anything that was kind of surprising to you, right? That stood out, something you didn't expect during your training from where you were to where you are today? Does anything in particular stand out for you?
Yeah, I think as most of us going into this field, you come in with this mindset of like, oh, I'm here to help people. I want to make changes for people. And I really came from this academic perspective of I'm going to go learn things and I'm going to like really understand these well so I can teach other people kind of how to live their lives. And like, I cringe as I hear myself think that now, because I think the thing I really learned in the process is like, yeah, that we are there to understand these principles and to learn, but that part that makes me cringe is that I thought that I was like I had myself in this above position of like I'm
Mm-hmm.
gonna know more and teach people how to do things. And it's so different from how I practice now and how I understand our work now, and being much more about, being a guide for people and helping them. They already know how to live their lives. It's helping them learn how to do that in the most effective way possible. And that's been a huge shift in from where I started to where I am now.
Yeah, and I guess, I mean, that to me, I didn't know what to expect when I was going into it, but very much that, and I think it's probably depending on the type of training you get and the supervisors who are training you, because I've worked with people who have that, hey, I'm the specialist, right? I'm the expert, you do this. And to have, it sounds like we're very similar, and these are human difficulties we have, and identifying what the person wants, and our job being, I think about it in terms of like what's getting in the way, these barriers, and what are the tools we know may be useful for you to navigate that. But it's this collaborative process, and not having that one up. It's, hey, we're on the same page and we're working on what goals you have together. It sounds like that, right?
Yeah, yeah, absolutely. And I think coming from that as a fellow human to say, hey, like this is this existing is hard to do, and I'm experiencing it as well, and I'm not more special than you are. I'm on this journey with you, but let's see if there's something we can learn to help you on your journey that's going to make it include less suffering or minimal suffering if we can.
Yeah. Yeah, no, absolutely. It really resonates with my own experience too and my own practice. With all of the treatments that you're trained in, and there are quite a few, right? Your expertise. Just curious about your favorite either type of therapy, why you love it so much, how you kind of got into that. There's plenty you could probably pick from, but as you hear me ask that, does one in particular kind of promote itself to the top for you and what you really, really enjoy doing?
Yes, and yeah, it's a difficult question because there's pieces I love about all the work that I do, but um, I'm going to cheat a little bit and blend two of them. And one of them is one that we've talked a bit about already, called acceptance and commitment therapy.
Mm-hmm.
And this is the treatment that I learned in the research lab I was involved in my undergrad, and um, that perspective is one that is just um, influenced all of the work that I have done from that point going forward. I really see it as a philosophy of how I see myself as a professional and honestly as a human as well.
Mm-hmm.
But I'm going to blend that with another type of therapy that I often do blend together with my clients, that I'd group them together as exposure therapies.
Mm-hmm.
So much of the work that I do, because it is anxiety, obsessive compulsive disorder, those areas, a big part of treatment is about doing things that we fear doing, and having ourselves engage in our lives and in practices that normally we would avoid. And so, one of my favorite types of work is having people do those practices from this framework of ACT, is the acronym for it.
Mm-hmm. And in particular, when you think about that and hearing Steve Hayes, one of the developers of ACT, that it really was a very behaviorism based and kind of exposure based type of a treatment. it can be weird to think about it like that. But in the service of, let's say, an act pursuing your values and your goals, even while we're experiencing all this discomfort. So it's one thing to get it like, hey, here are my barriers. I understand that. And then the next step is, what are we actually going to do about it? Which is where the committed action and actually moving towards those values. And so, yeah, your expertise with both of those, really slamming them together, I imagine that's a very powerful combination for a lot of the clients you work with.
Yeah. Yeah, and that's one of the reasons I love this work is that it's something that it can have such a dramatic impact on people's lives from really doing these practices and doing things that we're scared to do or that we normally would avoid doing.
Yeah. And there's so much in these various treatments of exposure and also of ACT. When you think about all these practices, we'll kind of go into, if you have, we won't say favorite because that's hard, but a
Mm.
particular practice or a skill or a tool that you found are, very useful for the clients you work with, even maybe useful in your own life, if you'd be willing to kind of share that and maybe even teach that or share aspects of that, so people can get kind of a more experiential sense of how this might be presented, let's say, in therapy, if they were to work with you or a therapist who does this type of work.
Sure. Yeah. So the main concept I think of, I shouldn't say that I think of a main concept that can really have a dramatic effect when I see people make this shift.
Mm-hmm.
The more technical phrase for it, we call it defusion. And it's not important that anyone remembers that, what that term is, but what it talks about is being able to engage in behavior. So be able to do things in our lives uh, in ways that doesn't match up or doesn't have to match up with what we're feeling internally. So said differently, of the like what's going on inside, any urges we have or thoughts that we have, doesn't have to dictate what we do with our actions. And it can sound like such a simple concept, but it's one that when I see people make that shift, that it is not simple in practice by any means.
Yeah.
But it's one that really can allow a lot of freedom in how we live our lives once we get that as a solid process. Um, it's not just one that I find to be one of my favorites, but it also, like, the research bears this out. Like, especially within OCD, we do see that that is a really important process for people to be able to separate out that internal world with their behavior.
Mm-hmm.
So yeah, if you want, I can walk you through a bit about what that could look like. We could
Yeah,
do a little practice with it.
that'd be awesome. Yeah.
Okay. So again, I'm going to go with something simple but not easy here. If you're interested, Ryan, you can do this with me, and
Sure.
anyone listening can practice this as well. What I'll have you try is to pause for a moment, and you're welcome to close your eyes if that would be helpful. And we're going to practice this process of doing something different than what our bodies are suggesting we do. So I want you to check in with your body to just see if you are getting any signals that are letting you know that your body wants you to do something. So you might notice an itch that's letting you know that you should scratch it. You might notice that there's some discomfort in your body that's saying that you need to move. Or if you're driving and listening right now, it might be that there's a suggestion that you need to hold your body in a certain way or hold the steering wheel in a certain way. And for a moment, I want you to practice not doing the thing that your body is telling you. And our job right now is simply to feel that urge. So for myself, I'm having an itch above my left eye, right on my eyebrow. I want you to really focus in on that urge and that experience. Notice if your mind is giving you any sort of thoughts about it. If your attention drifts away from it, simply come back to the urge. Notice what it's up to right now. You might even try to notice the shape of the sensation. If it's changing or if it's constant. See if you can let that be just as it is. And then when you're done or when you've had enough of that practice, you can go ahead and open your eyes. You can choose to scratch the itch if you'd like, or do the action if you choose, or you can continue to let it be. Do you want to hear my thoughts more on it, Brian, or do you
I
want to
do, and
try
we
it?
can talk. I didn't
Okay.
want to call scene to the
Yeah.
exercise too early. I definitely have thoughts on that, but yeah, let's hear your experience if you're willing.
Yeah. So this is one, like I said, it's a simple but not easy practice. And I'll often have people try this out as a way to really think of it as like building up a muscle of this concept. In that, like, if itch scratching is not a thing, or scratching an itch is not a thing that you're needing to work on, like, that's totally fine. But what we all just did in that moment is practice the skill of doing something different than what our body said to do. And that is something that we can apply in so many different areas of our lives. And that, like, anywhere that we practice that is going to be beneficial in building that up. So, um, yeah, I encourage people to really think of that as something that we can do at any moment to really build on that.
Yes, and so my experience, you had that itch that was coming up for me. There was an itch. It was kind of in my right temple. And then I was wondering if this was going to happen before during my clinical day. I had my window open and there's a fly in the office
God, I
here.
love it.
And so I had my eyes closed and it landed on my left ear
Oh
and
no.
super loud. And then I don't know if it picked up on the video, but like to my head and to over here. And the thoughts my mind was coming up with, like, really? It's happening now? And of course, an urge to itch, but like, of course, this would happen during this interview with Kate.
Mm,
But just to notice those, right? These are
yeah.
thoughts, they arise, these itch sensations, and being curious about, well, our mind's telling us it's going to intensify, it's going to get worse. So taking that more just curious, open stance about, well, what is this going to be like? Anyway, it was really fun for me to do that. And of course, so thank you to that fly for sure.
Wonderful. I'm just going to say that fly gave you a really wonderful opportunity to practice here.
That's right. What an opportunity that we say. So with
Yeah.
this practice, and I agree, this is when we talk about diffusion, the term is not as important as what this is signaling, but that we don't need to identify with the next thought or the next urge that comes up. To scratch is one thing in your practice, the populations, individuals you tend to work with. This one particular tool and kind of core principle, how have you seen this kind of impact the lives, the treatment progress of the people that you work with clinically? Do some examples kind of come to mind of what you've actually seen with people making this shift that you
Mm.
talked about?
Yeah. Yeah. The general stance or process that I see happen for people is that there's a shift to seeing that the world inside of us, the stuff that's going on internally, just um, it like 95% of it is meaningless. That like there is just a freedom that can come from that. Like there is just a freedom that can come from that, and so when I see people like in my work, like be able to sit through a panic attack and be able to come out on the other side of that and see themselves as unharmed and really stronger for it, of like being through something that didn't get to change their behavior. Like,
Mm-hmm.
that um, like one instance of something like that can just really shift how someone perceives themselves and what they are capable of. And I'd say I see that in lots of different ways of people, like for someone who fears that they may harm a family member by
Mm-hmm.
stabbing them. So it's a common thing that comes up as an obsession within OCD, that you might have an experience of like being able to make dinner next to your child and be sitting there like cutting with a knife while having this thought of like, oh, you could stab your child. Like that is it can be a very distressing and painful experience for someone to have.
Mm-hmm.
And when they start to learn like, oh, I can have this thought, this doesn't have to be influencing my behavior at all, it does feel just like a fly that landed on your head and then decided to go away at some point.
Yeah.
Yeah, so I really do think that people can learn how strong they are in these types of practices, which is really an honor to get to see that in my clients.
Mm-hmm. And with that, it's the freedom. That is my own experience too of putting this into practice. Is, well, these urges, these thoughts are coming up, and for so much of my life, it was, well, I should or shouldn't be having this,
Mm,
right? In that case, a good parent doesn't think about stabbing
mm,
their child,
yeah.
right? And so we kind of take on, what does this say about me that this thought or this urge is coming up? And to your point, to be able just to, well, do we actually need to do anything with that
Mm,
urge, right? There's an itch there, but you see that in OCD, these kind of examples. It is just such a sense of freedom to be able to drop the perceived urgency of, I don't know, do I need to do anything with this thought? Do I need to do anything with this emotion? And sometimes it's helpful to do that as a signal, but like you're saying, 95% of the time, maybe, or who knows, but that's often the experiment to run, though, right? Is this helpful in the moment? If so, awesome. That's
mm,
information. But if not, I don't know. What's it like to just cut up that tomato or something next to your kiddo?
yeah.
What's coming to my mind is, have you had people who are just like, I'm not willing. That doesn't,
Mm,
in other words, those barriers you slam up against. How do you tend to deal with that when people like, that sounds good, but there's no way in hell I'm doing that?
yeah. Yeah. Oh yeah. All the time.
Right.
Understandably so. Like
Yep.
I don't like doing the things that I'm scared of either. Yeah. There are other components to ACT that
Yeah.
really, I think, help bring that up and or help work on that concept. And it, it's like this stuff doesn't happen in a vacuum. Like I would not want to ask someone to do this type of practice. I really think just for the fun of it,
Mm-hmm.
because we are working on things that at least initially feel extremely intense and difficult, and it is not easy to work with these and continue living your life with these experiences. So I always want there to be the bigger picture of like, why are we doing this? And what is the point of cutting that tomato next to your kid? Like, if the person says like, I don't care if I can cook dinner next to my kid or have a knife next to my kid, like I don't know that we're gonna set that as a practice. But if they're saying like, yeah, I want to be able to like teach my kid how to cook, and in order to do that, I need them to be near me while I have a knife in my hand or while there is a knife nearby. So what we really focus on is saying, okay, what is the life that you want to be living? And then let's set some action goals around that. And
Mm-hmm.
then in the meanwhile, you might have some stuff happening inside your mind or in your body. It's telling you to not do that. And that's when we want to do this practice to say, like, I don't know that I need to attend to that signal that my body is sending me right now or that my mind is sending me. instead, I'm going to attend to what I want to be doing with my life, and I want to be spending this time with my kid here.
Yeah. And so really important if, people like, well, how does this benefit me to not scratch an itch or to deal with a fly? Well, that's the question, right? What is the
Yeah.
life you want to live? And then if this is something getting in the way, is it important enough for you to be able to tolerate some of that distress and to have this new learning happen? So if somebody were to work with you, that's a big part of it, right? Is figuring out the life they want to live, what's getting in the way, and then using some of these tools in a flexible way to help them continue that progress, right?
Yeah,
So I
absolutely.
I alluded in my life, this isn't new to me, and this is why I love a lot of these treatments, is it's not just theoretical. These are tools, and you don't need to believe any of it. It's try it out, and in my own life, it's been so useful and life-changing. I'm curious about with you, we can say diffusion or we can talk about values, but with these treatments, ACT, exposure, whatever it is, what have you noticed in your own life in terms of how this stuff has, played a role for you?
Yeah. Honestly, I'd say this is a concept I use on a daily basis. And it's one that, yeah, that so many of my decisions every day are from this stance of how do I want to be living my life rather than what my body is telling me to do. Like regularly, my mind and body are not telling me things that are helpful. So, uh, yeah, I can think of lots of examples. I'd say the biggest one that comes to mind is I have a decent fear of the ocean.
Mm,
Decent meaning like it's a fairly large one in my life. And I happen to be married to someone who just loves the ocean and loves surfing and being in it. And it's so important to him to be like to spend time with me in the ocean.
mm,
And so you can imagine how that might not work out to well if I were to just follow that fear every time. If I were to
mhm,
say, like, you know what, like that is not something I want to do. That's going to be uncomfortable. I'm going to drown. There's scary things under the water. Like all the stuff my mind can throw at me there. And
mhm.
sometimes I do follow that stuff. And I'd say for people listening to understand that what we're talking about here, it's not that we have to be perfect at this and do this every time, but being aware of the decision that we're making and how we're making it. And so, yeah, sometimes I do avoid. I feel like, today's not the day that I'm going to be able to like do this thing that's important to me. And other times I've like gotten in there and I am in the midst of a wave like smashing me in the face, and like honestly even talking about it right now my heart just like starts beating faster. I'm like thinking of that experience, but all through that process I'm like I am here doing this because this is so important to my spouse, and like I really do want to be here with him, and it is an experience that I really do enjoy when I do that with him. um, but it's one that I really have to practice feeling and embracing the stuff that comes with it, and not listening to my mind when it is just like get out of here, this is so not okay. But I'd say I even use it at like a smaller in smaller scale decisions. Well, actually, this isn't a small scale one, but like Brian, you're aware of this based on my response to your request to do this podcast. Of like that, my response to you was, yeah, this makes me feel like vomiting doing this, and I'd love to. Like, there's
That's right.
um, like public speaking or being recorded while speaking is something that just naturally makes me anxious, and
Mhm.
so yeah, I saw your email. It was like, oh no, I'm not doing that, is what my mind just said. And then I decided, like, actually, no, I do really want to do this. And so I practiced doing something different than what my initial reaction was. So yeah,
If
it's all over in my life.
if you weren't going to raise that, I was going to bring that up because that came
Great.
that just immediately came to my mind of like, oh, that's what you responded was,
Yeah.
yeah, this I feel like vomiting and absolutely I will do it.
Yeah.
And I don't know if you found this, but the more and more I practice this particular skill, right, of diffusion, also there's acceptance, there's values, all this stuff together that ACT, kind of combines. I've come to view those signals when they come up as that's like a salient signal of this actually, there's a reason there's this reaction. And oftentimes I found that the things that terrify me the most tend to be some of the things that when I truly step back and think about the life I want to live, what's
Mm.
meaningful to me, how I want to be remembered, so I can kind of use that discomfort as this might be pointing me exactly to what otherwise I would want to be doing. And so how do we move forward? I don't know if you've noticed that too, but I definitely have.
Yeah, absolutely. I think we learn those signals for ourselves of what are those tendencies that we have that
Hmm.
yeah, I think we talked about it in the email of that like vomit barometer where it's just like, oh, okay, that's a sign that there's something here that like really does matter to me. And not all the time. And that's one of the things I would caution people against is yeah, sometimes that vomit barometer is actually saying like, no, this is dangerous. You do need to stay away from this. Don't do this thing.
Yep.
And that is part of this practice is learning like when is it useful to attend and follow what our minds and bodies are telling us, and when is it useful to not do so. And my suggestion from that is to always do that based on what the effect of that is. So for surfing with my husband, like that the effect of that is like, yeah, I haven't been eaten, I am like, I didn't drown, I felt pretty uncomfortable when water went up my nose, and I got to spend a really wonderful quality time with my husband. And to me, like the effect of taking that action made sense for me to not listen to my fears. If I
Hmm.
was like getting bitten by sharks every single time I went out there, then I might be like, yeah, I probably shouldn't listen to, or I should listen to that fear and stay out of the water.
Yeah. And so much of the time, these signals, how I used to be, is these were very all or nothing. Like, I feel discomfort. That then means this isn't worth doing. We should avoid it. And that's where I guess it also is coming up for me just to normalize how this makes sense is to avoid things that are uncomfortable.
Mm,
That's why this is a skill and a practice, and why somebody like you who's been trained in this can help people walk through it again if it's meaningful for them. But to say this is kind of the default response, and it can really get in the way of things that matter to you. Yeah, that's just coming to
mm.
my mind is this was such a pattern for me. And so learning this other way, super counterintuitive, but very powerful. And just like what you're saying, this is a practice. It's not one and done, and very flexible too. Like it could be useful signal. Maybe it's getting in the way, but testing it out and seeing what's going to be useful for you. Right.
Yeah, it's a really great point in that, um, like, of course, we would want to avoid things that are painful. Like, that's human nature.
Hmm.
And so to be able um, yeah, give ourselves some compassion in that of like, yeah, this is going to be hard. And is there a reason why I would want to do this hard thing?
Yeah.
And absolutely, it takes so much practice. I've been doing this, oh gosh, I don't even know how many years now, like probably 15 years, and like it's a daily practice that I do. It's not
Hmm.
something that I'm ever able to say like, oh, I've got that one, like I am done, don't need to work on that anymore. Like
Yeah.
it's something that there's always growth that can happen there.
And this just came up for me as you were saying that, which is some people, when they think about, well, Kate sounds awesome, this therapy seems awesome. And if I commit to this, well, she's been practicing it for 15 years. This is going to be a 15-year commitment to do this work.
Mm,
If somebody is struggling with perfectionism, with OCD, with repetitive, behaviors, movements, all that, I know it varies about what the treatment goals are, all that kind of stuff. But in your practice, what's kind of an average timeline that you tend to see if people are just assuming, well, I don't have decades to devote to this?
mm.
What do you tend to notice in your practice with you and also, let's say, the other clinicians who are in your practice? I just think that might be interesting for people to get a little clarification there.
Yeah. The average for me as a clinician, so this doesn't include the other providers in the
Hmm.
practice, that my average is about 20 sessions that I
Hmm.
work with people. And it's an average, so there's more and less from that for each person is individual there. But yeah, it's not something that you would need to work with a professional for 15 years and doing this work. Like my intention and and the intention of a lot of these evidence-based therapies are for people to learn these concepts and skills and get them really kind of solid on understanding them and how you can implement them in your life, and then for you to be able to go on with your life using them, and maybe coming back for some booster sessions or times where you maybe get caught up in it again and need to kind of a reminder of the practice, and you can come back and do that. But my hope for people is not that they have to be in therapy for years and years and years. It's more of maybe a few months of really doing some hard work on this to get you a jump start into doing this for the rest of your life.
And that it's just such an important point that surprised me because I had no idea coming into it. But the assumption is, well, who knows how long it's going to take? It's this huge thing. But yeah, that this is a couple of months. It does require a commitment to practice this stuff, if you're willing to. But yeah, that's one thing about these evidence-based treatments, that they tend to be more time limited. It's not a 12 session and done unless it's, you're in an environment that only allows for a certain amount. But that can be helpful to know that, hey, this isn't year long, and I can always flexibly come back, to meet with Kate or whoever else if I need to. But it's when they feel like they have a solid understanding and they feel like their goals are met, right?
Yeah. And I'll often suggest for people, and if either time or resources or for whatever reason, that like even if 20 sessions is too much and that feels like that's not something that's doable for them, there's lots of self-guided resources out there about these topics. And I can give you the website, our company website. We have a resource page that gives a lot of these options where people can also start by diving into those. And then like after they've gone through that and maybe still have questions that they're wanting to work with a professional, then it's a great way to kind of condense the amount of time that you might be working with a professional as well.
Yeah, absolutely. Well, yeah, let's maybe go there and say, well, for people who they're thinking like I do, Kate is just lovely, right? She's so knowledgeable. She's been doing this. But so if they want to learn more about you, your ongoing work, your practice, if they want to find that resources page with some of these, self-guided exercises and practices, where would you point people to if they want to know more about you and all this stuff?
The main spot would be our website, which is Juniper MH, as in mental health. So our company is Juniper Mental Health.com. And so that would be the main spot. We have a resources tab there where you can get that information. That's also where you could find me and the other therapists in our clinic. So we are an all telehealth clinic, meaning that we practice all through video. We're only able to practice in certain states. And so that's something that's listed on all of our bios as to where we can practice and what we specialize in. And then I am not a huge social media fan, but we are also on Facebook at Juniper Mental Health and LinkedIn for Juniper Mental Health. And those are two great spots to follow any updates that we have there. But you can also reach me by my email, which is katemorrison@junipermh.com, which is also on our website and my bio if you lose that.
Great. Well, Kate, I know we could talk for many, many, let's say, if not hours, I mean, for quite a lot longer. But thank you so much for, despite the sensations of wanting to vomit when I reached out to you, just know I'm so grateful for you taking the time and to be here. And yeah, it's just an absolute pleasure. And I really appreciate you taking the time.
Of course. Thanks for doing this, Brian. I really appreciate it.